So most children with atopic dermatitis would have frequent itchy, dry, red rashes on different parts of their body. And most times if the itchiness persists for long, the skin barrier can become broken, and then they are prone to having infections, different bacterial and fungal infections. Good day everyone, my name is Dr. Jegede Adedamola. I'm a medical officer here at Kaaf Specialist Hospital, and today I'll be talking to us about the management of atopic dermatitis in children. Atopy means allergies and dermatitis means inflammation of the skin. So in clear terms, atopic dermatitis refers to inflammatory changes of the skin due to allergies. The cause of atopic dermatitis is largely genetic, although there can be some other influential factors such as environmental triggers. It's also very important to note that children with atopic dermatitis would most likely present with other conditions such as atopic conjunctivitis, meaning frequent itchiness and redness of the eyes whenever there are irritants around, atopic rhinitis, meaning they are prone to having a runny nose whenever they are irritated or when there are allergens around them, asthma, and also they would most likely have food allergies. Most children with atopic dermatitis would have frequent itchy, dry, red rashes on different parts of their body. And most times if the itchiness persists for long, the skin barrier can become broken, and then they are prone to having infections, different bacterial and fungal infections. And it also affects the quality of life of these children most times, because it peaks in school-aged children, and most times because of how bad the itchiness can be, it affects the quality of their sleep, which can also go on to affect the academic performance in the long run. So having said this, how do we manage this condition? First of all, we want to prevent these rashes in the first place, and the management of atopic dermatitis starts and ends with moisturizing the skin. So first of all, you want to start by using emollients while a child is taking a bath. So simple things like putting some drops of olive oil in warm water to take a bath for an affected child goes a long way. Then secondly, you want to use a moisturizing bar or a moisturizing soap, meaning a soap that is not going to strip the body of all its moisture after cleansing is done. Next, you want to go in with a moisturizing lotion. So note that I said lotion, not a jelly, not oil, because jellies and oils would just sit on the skin and won't hydrate the skin properly. Despite all these measures, a child keeps on having itchy, inflamed rashes with broken skin barrier, affecting the child's sleep. It's very important to bring them to the hospital so that they can be reviewed properly. Thank you very much.